There we are. Okay, what's up, everybody? Another Monday, another lunchtime, and here we are with Dr. C, and I'm Daniel Trivy. We are the co-founders of Regenerative Sports Spine and Spa here in the Orlando area. And today we are going to talk about orthopedic issues, bone, muscle, joint, spine, all the things, but how to use or why you should use PRP versus some of the traditional methods, right?
Right.
Okay, so let's start first of all with talking about PRP. Like, what is PRP? Give us the definition.
So PRP is a platelet-rich plasma, and the way we get it is we do get it from you. We draw some blood and then spin it down and get a yellowish substance that has a lot of anti-inflammatories, growth factors, all those kind of good things that can help with repair and inflammation to a more natural extent than steroids, for example.
Very good. So with and why does the blood, like, why would PRP from your blood, like, what's this, I guess, the real science behind it? I say all the time, you get a cut and the blood does a certain thing to help. So talk about the blood a little bit and its properties and why, like, PRP is something that people should consider.
Well, like you're saying, if you get a cut, it's like the blood goes to that area and tries to close it up and heal it, right? So the same thing, we do have healing properties in our body in multiple areas. Blood is one of them. Obviously, bone marrow is the other. We use that a lot. Fat is another one. So we have healing properties in our body all the time, but sometimes, they don't always go to the area that's been injured, but then it's been chronically injured. So it's one of those that, it kind of is like dormant troops that are waiting for action, and then with an injury, then they go to the area of action. But then after a while, they go back to being dormant, and so they don't
Right.
necessarily help heal after a certain amount of time. So what we're doing is getting this product that does help that's in your body, and then injecting it into the area that needs help to stimulate more repair, and then more healing factors to that area.
Right. It's concentrated, right? Because if you think
Right.
about, when we would buy like detergent now and all the thing is it's concentrated so you can use a less amount, right? So the same thing applies with your blood and the healing properties in your blood. So we can pull your blood and spin it, and then you get a concentrated dose of that healing power put right to the spot where you need it. So what would be some of the ideal spots for PRP? Because PRP isn't great for everything, right? But PRP is really good for some specific things. So what are some of those things that people should be looking at using PRP for versus steroid injections or surgeries, that kind of stuff?
So PRP is actually quite versatile. Today we're going to go over all the orthopedic stuff, and then we'll expand on other uses in the next couple of weeks. But if let's say you're going to do a steroid injection in the knee or a steroid injection in the back, as we know, the steroids can be damaging, especially if you use it more than once. So we can actually use the PRP instead of the steroid and get typically a longer lasting result and a better all natural result too. You're not damaging tissues to try and help get you better. You're actually doing stuff that helps the tissues get better, and then actually feel better for a longer time. So let's say if you have some inflammation in the knee, you can do this. If you have, it's typically tendon, ligament, muscle react the best, or you can have some nerve inflammation that it can help with. Um, or some minor arthritic changes like in a joint like shoulder or knee, but if it's more of a severe arthritis or something like that, it won't necessarily be strong enough.
Got it. Yeah. So what are some of the common, like, diagnoses that people should consider? Is it like Achilles tendonitis, elbow tendonitis, like golfer's elbow? Like, give us some actual diagnoses that PRP should be considered in its use versus like steroids or surgeries.
Okay. Rotator cuff tendonitis, you can have bursitis, shoulder, knee, patellar tendonitis. I've done a couple of those recently. Just minor arthritic changes and inflammation in the knee. You can have sprain, like an ACL, MCL, or LCL sprain. Golfer's elbow, tennis elbow, those are all tendonitis as well. You can do Achilles tendon, just in general, really anywhere where there's ligament, tendon, muscle, those kind of things, and just inflammation. So you can put in all those areas.
Got it. Very good. And then, we talked about some of the dangers of repetitive steroid use. The winkies the tendon. There's research out there that shows it can damage the cartilage further and actually prevent real healing. But steroids do a really good job of reducing inflammation and pain, but they're undoing some of the natural healing processes, which is why we suggest people use more of a natural source like a PRP. And you hear, I've said this in weeks past, you hear a lot of baseball players when they have elbow tendonitis, they're using PRP to help with the elbow issue, right? They're not using steroids anymore because steroids have been shown to cause damage to the joint. So if you're just joining in this, we're talking about PRP and natural healing factors that come from your blood as a way to heal things like tendonitis and more of those minor orthopedic injuries that people suffer from on a regular basis. If you have questions about PRP, what it is, how it works, drop them in the comments. If you're watching now, we'll be happy to answer those. And if you're watching this post live, we'll go back and answer them in the comments. So please ask questions about this stuff. Now, as far as using PRP inside of a joint, what are some of the limitations that PRP has for like a real cartilage damage or in the spine for herniated discs? Is that really the best use of PRP for those types of things, or should it stick more to the inflammation of like the elbow tendonitis, the knee tendonitis, that kind of thing?
For the most part, it should stick with more the inflammation of the tendinitises and muscle injuries and things like that. What we've seen in treatments in the past is that it's not quite strong enough to help with herniated disc or even a cartilage tear. So because really it's just getting rid of some inflammation, it's not going to the point where it can get some of these larger issues better. So it is definitely helpful, but you have to pick and choose the things that you want to use it for. It is widely used, but yeah, if you have herniated disc or a cartilage tear in the knee or a cartilage tear in the shoulder, or even a large rotator cuff tear, it's really not going to be strong enough to get the healing and repair that you want or need and get you back to activities. So we really want to look at other choices for that.
Good. And then as far as age, are there any restrictions on age when it comes to PRP? I know a lot of people, there's some literature out there that says that, the older you are, the less viable the healing factors are in your blood, so on and so forth. Is there any realness to that?
There is, it's like absolutely, it's like the healing properties in your blood and even your bone marrow do reduce over time, like stem cells and growth factors, things like that. However, it's still helpful, and it's still better than, steroids, so if you're an older person and you put steroids in your joint, it's actually probably worse for you than actually just, leaving it alone. So, and it's better to do the PRP, even if it's a little less potent, because you still has the growth factors in there. The number may be less, but that doesn't mean it's not going to still help you. Right. So yeah, absolutely. There's less healing factors in both of those areas, but it can still help even if the numbers are lower. Right. So, but that's what I've seen with our treatments. I mean, I've treated people in their, 70s and 80s, and they still get really good results with these. So it's not something that you should worry too much about age with this type of treatment.
Got it. Okay. And then as far as, is this a one-time thing? Can people come in and get one PRP, or do we need to have more than one? Does it take 2, 3? What does the actual treatment process look like over time?
That's a great question, Daniel. So typically, I recommend at least 2 sessions. And depending on the severity, if you've had this for years, we may need to go to 3 sessions, and it's typically 1 month apart. And let's say for certain things, you may need to get this once in a while, let's say once a year or that kind of thing. The first time you do it, it'll be 2 to 3 sessions. After that, if you're still having minor issues, we can just do 1 session at a time and just see how you do. But it's not something that you do 1 session and then you're great. It's like it really does need, especially for a longer term damage, which most people, when you come to see me, it's like you've had the issues for a while. It's not something that just started a month ago, right? So if it just started a month ago and you're lucky, we may be able to do 1 and be fine. But typically I get people who've had it for months or years. And so we do need to do a couple of series in order to get the best results.
Got it. And this type of procedure does not involve a hospital stay, right? We do all these inside of our facility. We take your blood right there, and everything's done at the same time. We do blood, and then we spin it, and then we inject it, and it all happens in our office in one fell swoop.
Correct. Yes. And we have a nice procedure suite back here. And so we do all things sterile, make sure it's clean process and then it's your stuff. So
Very good. Nothing better than using your own blood. I don't want anybody else's blood going in my body. And
no,
then the
not.
process afterwards, like how much time are we talking about to notice differences?
Typically about 6 weeks or so, you'll notice a difference. So after your second session that you do, and then it should continue to get better over time. I mean, I've had this done in my shoulder, and I think it took a couple of months to really get the best result. And while I was doing therapy and things like that as well. So,
Sure.
I mean, a lot of factors that we need to pay attention to. I mean, physical therapy is going to be essential regardless of the procedures as well. So that is something you need to work on, especially joint stability, all those kind of things. So you're taking good care and then getting everything working the right way. And so it took me probably a couple of months to really notice the biggest difference on my shoulder. What about you? You've had it done.
Yeah, I've had it done. Need to have it done again. I've had it done in both of my lovely elbows here we talked about last time. And it did. I did one session and it did help minimally. But I needed to follow up. I needed to do another one to really get that extra boost of healing there. Now the biggest issue is, elbow inflammation is one of those long processes to get rid of because we use our hands so much gripping, squeezing, typing, texting, steering wheel, driving, all the things. So when you're in an area of continued use and just chronic overuse, when you have an inflammatory response, you're going to need a couple of those follow-ups. But I think even more so, you're going to need to get into a really good physical therapy regimen. I think a lot of people neglect that part. And that's why a lot of people like steroids too, because, it gets rid of the pain. I'm good to go. I don't have to go to therapy because therapy is not sexy. It takes a long time. And I say this all the time. Physical therapy is not the most sexy thing on the planet. And it does take a lot of time, a lot of work, and a lot of energy to do it. But the number one thing out there, as far as the research goes, that says what you really need to do to get better is exercise. It's physical therapy, and it's the right type. You can't just go to the gym and just start cranking iron thinking I'm getting stronger. You need the specific therapeutic modalities and exercises that are really going to help change the mechanics, right? It's not just overuse that causes the problem. Sometimes it can be from another area of your body that is demonstrating weakness. So you're putting extra stress on your knee or your Achilles or your elbows that's causing this inflammatory response. You need to get into a really good physical therapy regimen that can determine exactly why there's so much stress happening to that area and what's influencing that inflammation. So I think that's a big part of what we do too, right? We want to make sure that we're not just giving people shots and sending them on their way, but we're entering them into a really good physical therapy regimen with really highly qualified people. Like I don't know about you, but we're not sending these people to the regular everyday high volume. I was one of 15 people being treated at a time.
Right.
That is not something that we believe in as a facility. Like you should have one-on-one directed treatment and care.
Right.
That should be part of your physical therapy. So correct me if I'm wrong. Stop me when I start lying.
No, absolutely. It makes a big difference. And we have a couple of centers that do that one-on-one, and they do a great job. So that's typically where we like to send people to make sure that you're getting all the proper exercise and you're doing them correctly. I mean, it's like anybody can tell you to do an exercise and then walk away. I mean, how much benefit do you really get from that? It's like if you're not doing it 100% correctly, it's like it's going to be a problem.
Sure.
You got to make sure it's being done the right way in order to get the benefit that you need and, for the future. So otherwise, it's just a waste of time and money.
Yep, absolutely. Absolutely. Well, our time is almost at an end here. We got about 30 seconds. Anything else you can think of about PRP for bone, muscle, joint, and spine types of things, or do we catch them all?
I think we caught it all. The only other thing I'd probably say is if you have an injury that just came on a couple of weeks before and you're still having trouble with it and it's lingering, it's like that's actually a good time to do PRP, like the first line of treatment, not the last.
Yeah.
So just think about that as getting your body better quicker rather than waiting a few weeks and then having a harder time with it.
Yeah, the idea is to eliminate some of these doctor's visits, guys. Like, we don't
Right.
want you to go onto the doctor over and over and over again for more pills, more shots, more pills, more shots, surgery, more pills, more shots. Like, that's end the madness. Instead of, usually people end up in our office, like you said, it's their last attempt. We want to be the first line of defense rather than the last resort to get well, because this stuff really does work. And we have seen people who've gone through years and years and years of issues have these type of procedures done and feel better in 6 weeks, and they're amazed. They're like, why didn't I do this before? Why isn't this pushed more often? And the reason is because our system is set up to keep you in the doctor's office, keep you buying medicines and doing things that don't actually change your inflammation or your, and I hate this phrase, but I'm going to use it, the root cause of the problem, right? So we need to start thinking more about using PRP as a first source and a first treatment rather than a last resort.
Agree 100%.
So, all right, everyone, if you're watching after the live, please comment, tag people. If you know people who need PRP or need a different source of treatment, we would be happy to take care of them, especially if you're in the Central Florida area. And even if you're not, we have a really cool VIP package. The only thing you gotta do is get your butt on a plane. And when you're here, we have drivers that will pick you up from the airport, professional drivers, not like me. I'm not coming to get you, but we have a professional transportation group that'll come pick you up. We put you up for a couple nights while you're here. That same transportation group will take you from the place that you're staying in to our facility and back. You just need to get here and bring somebody that can help watch over you while you're staying. If that's something that you're into, that you need, and you want some specialists who are really good at what they do, that one right there will definitely help you out. Sorry, I was backwards.
Wait, I'm with him.
Yeah, that one. All right, everybody. Thanks again for watching. Share this with lots of people. We want to change the dynamic when people stop having senseless surgeries and overuse of medications and steroids when it comes to their bone, muscle, joint, and spine issues. And then next week we'll talk PRP for cosmetic stuff, right? How can PRP make your skin look pretty? How can it make your hair grow? How can it fix your erectile dysfunction? So we'll talk about those things next week. So take care, everyone. Have a great week, and we'll see you next time.
All right. Thank you.
Mm-hmm.